Hello viewers, welcome to HMS Desk. Today, let's explore the world of ACL reconstruction surgery. ACL, anterior cruciate ligament, reconstruction is a surgical procedure that aims to repair a torn or damaged ACL in the knee. The ACL is a crucial ligament that provides stability to the knee joint. ACL tears are common among athletes or individuals who engage in sports or activities involving sudden stops, changes in direction, or jumping. Here is a generalized step-by-step guide to the ACL reconstruction procedure. Preoperative evaluation. Before the surgery, you will undergo a thorough evaluation, which may include a physical examination, imaging tests, such as MRI or X-rays, and a review of your medical history. This helps the medical team assess the extent of the ACL injury and determine the best approach for reconstruction. Anesthesia. Once in the operating room, you will be given anesthesia to ensure a pain-free experience during the surgery. The anesthesia options include general anesthesia, where you will be unconscious, or regional anesthesia, where the lower body is numbed while you remain awake. Incision and arthroscopy. The surgeon will make small incisions around the knee and insert an arthroscope, a thin tube with a camera attached, to visualize the inside of the knee joint. This allows for a clear view of the ACL and surrounding structures. ACL graft harvesting. The surgeon will select a graft source to replace the torn ACL. Common graft options include autografts, tissues from your own body, such as the patellar tendon or hamstring tendon, or allografts, tissues from a donor. ACL reconstruction. Using specialized surgical instruments, the surgeon will remove the damaged ACL and prepare the bone tunnels in the femur and tibia. The graft is then secured in place using screws, staples, or other fixation devices. The graft serves as a scaffold for new tissue growth, gradually becoming a new ACL. Wound closure. Once the graft is in place, the surgeon will close the incisions with stitches or staples. Sterile dressings or bandages will be applied to protect the surgical site. Post-operative recovery. You will be moved to the recovery room, where you will be closely monitored as you wake up from anesthesia. Pain management techniques, such as medication and ice therapy, will be utilized to ensure your comfort. Rehabilitation. After surgery, a comprehensive rehabilitation program will be initiated. Physical therapy will play a crucial role in helping you regain knee strength, stability, and range of motion. The therapist will guide you through exercises and activities to gradually return to your normal activities and sports. Follow-up care. Regular follow-up appointments will be scheduled to monitor your progress, assess knee stability, and adjust the rehabilitation plan as needed. It is important to note that the ACL reconstruction procedure may vary slightly depending on the individual case and the surgeon's technique. At HMS Desk, we understand the significance of ACL reconstruction surgery and its impact on restoring knee stability and function. Our team works in collaboration with renowned orthopedic surgeons and modern medical facilities to provide world-class treatment and personalized care throughout the entire process. If you are considering ACL reconstruction surgery to regain knee stability and return to an active lifestyle, don't hesitate to reach out to HMS Desk. We are committed to supporting you and providing access to exceptional healthcare services. For more information, visit our website at hmsdesk.com or email us at support@hmsdesk.com. Don't forget to subscribe, like, and share our channel to stay updated with the latest healthcare information. Thank you for watching, and we look forward to being a part of your journey to a healthy and active life through ACL reconstruction surgery.